Hey everyone, my name is Daquan Johnson, an MD PhD student at the University of Maryland School of Medicine. And for my subscribers, I'm super sorry for going MIA for the past few months, but I really had to put in that work to make sure I finished my preclinical years strong. And I'm glad to say that I'm finally done. So for the next few years, I'll be a full-time graduate student. I guess right after I finish step one, which is a story in of itself. So we'll talk about that maybe a little bit later in some future videos as I start studying and preparing for it. But right now, I've been asked by a subscriber to vlog a day in the life of an MD PhD student. Unfortunately, I'm not going to vlog in this video as the title suggests, but I will give you an idea of what my preclinical days will look like. And so I struggled with thinking about what a vlog will look like because each of my days were very different. And that's because of the way how our curriculum was set up at Maryland, and the fact that each of our afternoons kind of had something different. And so I'll show you what a sample schedule will look like for my day. So if I share my screen, you should be able to see that typically Monday through Friday, my days mostly consisted of study, but it kind of filled up with different things. So a lot of the times before my required classes that were always from 8 to 10 every single day, like clockwork, I would try to sometimes squeeze in 1 or 2 experiments right before class and try to end them right after class. So things that can be pretty much automated. So what I mean by like each day was different, if you look at my Mondays were pretty much my most effective days in terms of studying because that is the afternoon that I pretty much had free routinely. And because we had our lectures that were recorded and filmed online, I typically wouldn't go to lecture. I would use that time usually to study, pull a reaction from one of my lab experiments, or I would tend to schedule my meetings that I want to stick in there that I usually have for like academic services or anything else I had to meet with professors or anything like that. And then most of my afternoon would be filled with studying and I'll go home. So some of my days will be pretty boring. But days in the middle of the week, like Tuesdays, we'll still have the clockwork or our classwork in the morning, our small group they were called. And these are, because our class is about 160 students, we will break our class down to about 20-ish students so we can have a better professor to student ratio so we can really grapple with some of the more difficult concepts and work through them. After that, I would usually review the previous day's worth of work, try to solidify what I studied the day before, or usually I would try to prepare for clinic because Tuesdays tend to be my clinical days. So I would try to use that time to kind of prepare, get myself ready, write up notes, and write up my history and physical, which for some of you who are in medical school already know that you have to do your history and physical write-ups for your patients. And then I'll spend the rest of my afternoon in the clinic with some of my preceptors, which is just a fancy word for the doctors who are teaching how to do interviews, ask or take histories from your patients, or also do physical exams. And so Tuesdays, for whatever reason, I think even all my classmates would agree that after you do this clinical portion, which we typically call ICM or Intro to Clinical Medicine, for whatever reason, you're always super exhausted afterwards. I think it's just because you're super nervous and you're like still learning how to take histories, you're still learning how to do physical exams, so you're still super nervous, and it takes a lot out of you. And so typically, like you can see me studying here, I typically don't study after that point just because I'm pretty much burnt out for whatever reason. But my classmates will typically agree that after you go to clinic, you're pretty much not getting any other work done. Then Wednesdays tend to be my service learning days. So for the morning, we'll still, of course, have our small groups for the content we have to learn. I would take that next amount of time to review the content from yesterday because I really didn't look at it too much. So these Wednesday review sessions are super important because I would typically miss the Tuesday entirely because I would be studying and preparing for other things. And then after that, I would have to leave campus and travel because I used to teach an enrichment course for gifted and talented 3rd and 4th graders. And so I would spend that 1 to 2 p.m. time traveling to the elementary school I actually used to attend and then actually give science enrichment courses. So teaching different experiments, teaching some basics in science, and trying to keep them excited about science, hopefully so they can pursue it and see themselves in me. I think I would really appreciate that when I was younger, having a person who looked like me, showing me how cool and awesome science could be, becoming a physician, because when I was that age, I didn't even think about becoming a doctor. I'd never seen anyone around me who looked like me become a doctor. And so now they see students like me coming in, teaching them they can be doctors and showing them how cool science is. I think I really enjoyed that. It's called a talent mentoring program. I'll actually link the page to their program in the comments below. After that, I would tend to go home. I would usually try to read and review papers from my molecules of medicine class the next Thursday, which is an MD PhD specific course. But typically, once I get home, typically my mom wants to know how my day was because I still live at home. And it would tend to be like not very productive right after I come back. And so typically I wouldn't start studying until after dinner, which tends to be about 4 o'clock for me. And so from about 5 to 9, I would try to get in some solid study time before I go to sleep and start the same thing the next morning. Thursdays, we tend to also have very busy afternoons as well. We'll still have our class. I will review the Wednesday information before, review the paper for my MD PhD specific course. And then from time to time, I would also have lab meetings I would attend because I've already actually decided on which lab I'm working in. And so at that time, I'll go from that class to my lab meeting. And if there was a conflict, I'll go to lab meeting instead. And after that, I would usually get a good bit of studying in, usually stay on campus pretty late. And then on Fridays, anything can happen on Fridays, actually. So Fridays, we'll have our class in the morning. I would try to study before noon. And then I'm trying to hang out with some of my classmates, goof off, joke, talk a little bit, socialize. And then after that, we'll have these things called PIDAs. And these are typically things you'll learn when you come to medical school, is that you actually don't know how to listen to a person's heart, listen to a person's lungs, take blood pressures, test reflexes, any of those things. You don't really know how to do those when you come in most of the time. And so we actually have hired actors who teach us these things and show us the proper way and proper techniques of doing these things. So typically we'll have these sessions, sometimes graded, sometimes not, where we'll go in, we'll have to review some of those techniques and some of those physical exam maneuvers, and then we'll go in and we'll practice in a controlled setting. And typically that was another thing that kind of tires you out quite a bit, and also kind of throws a wrench inside of your schedule, because it can be scheduled either Tuesday through Friday, and it's quite variable. And then after that, you'll try to study because, again, you have to catch up for some of the spots that you missed throughout the week. So as you can see, each of my days were very different, sometimes in the clinic, sometimes off-site at a different school teaching third graders, sometimes in a lab, sometimes in an MD PhD specific course, and sometimes in a controlled environment, learning how to listen to hearts and lungs from actors. So as you can see, it made it very difficult for me to try to conceptualize what a vlog would look like. Hoping in the future, after the coronavirus clears up and things like that, I can start vlogging a little bit more of my PhD years and getting used to seeing whether or not you guys like that type of information. But hopefully this right here gives you a little bit more insight in terms of my day. Sorry I couldn't do the vlog for the preclinical years now that I'm done with them, but hopefully we can continue forward and we can get some more information. And that's it from me today. So like, comment, subscribe. If you have any other questions, drop them down in the comments below, and I'll try to get to you as soon as I can. And give me some more ideas in terms of what information you want to know and what other videos you'd like to see. Look forward to speaking with you all soon. See you in the next video.